The crisis due to coronavirus continues to be a menace in India. However, looking at the data from the last 2 weeks, it seems like that the rate of the growth of the coronavirus cases in India seems to have slowed down, with the number of the cases per day in India during the last week decreased from around 4,14,000 to around 2,60,000 cases per day. Previously, however, there was a rapid increase in the cases that was seen over the last 2 months when the cases rose from around 12,000 cases per day at the start of the month of March to around 414,000 cases per day during the first week of May. This moderation of the growth in the number of the cases seemed to be the result of implementation of the lockdown of various degrees at various parts in India, as well as people started to follow the appropriate COVID-19 related social behaviors such as wearing masks or following the social distancing protocols and also avoiding going out of the house unnecessarily. In the coming weeks, once the situation improves a bit, the lockdown can be eased in the most part of the country and used sparingly in whichever part the infection seemed to get out of control. A thing which can be commented over here is that although there are always things which anyone can believe that the government could have done better, it would have been difficult for any government in the world to have managed such a steep rise in cases. And this is the primary reason why the situation in India turned so dire. However, the huge number of COVID cases has kept existing medical infrastructure in India crippled. During the past few weeks, the major chaos faced by the hospitals was the shortage of the oxygen for administering to the patients. The latest reports seem to suggest that while the problem with the oxygen was not with the production, as the oxygen demand in the country is just 8,100 metric ton per day, whereas the production of the oxygen currently in the country is over 9,000 metric ton per day. This increased production is the result of the diversion of industrial oxygen from the steel plants and oil refineries for the medical usage. The crunch, however, lies in the distribution of the oxygen because there are not enough cryogenic tankers present to distribute the oxygen from the production plants to the hospital. The situation of oxygen supply has improved a lot in the past few days as government has taken measures to remove the shortcoming in the distributions of oxygen, such as a lot of tankers which were meant to carry nitrogen, argon or LNG have been converted to carry the liquid oxygen. India today has around 1600 tankers which can move the liquid oxygen compared to the 1200 tankers before the start of the second wave. Some claim that this number can go as high as 2400 tankers. Another thing that has been done is the oxygen tankers have started to move through the trains, which obviously will bring logistical efficiencies as more volume of oxygen can be moved towards the hospital. The trains can run faster than the tankers, therefore, more volume of oxygen can be moved towards the hospital. Moreover, a lot of new oxygen generators and concentrators are being installed at the hospitals in various cities. This problem of oxygen shortage at the hospitals is likely to improve in the future, as just because there was never any issue with the production of the oxygen in the country, and with the various measures that have been taken, the distribution situation in the country is likely to improve in the immediate future. Experts have suggested oxygen distribution problem in the country is likely to get fixed in the month of May itself. In my previous video, I have said that looking at the results of the vaccination in US, UK and Israel, it appears like that once any country with a decent enough vaccination program vaccinates a reasonable percentage of its population, the coronavirus infection in that country seems like it gets under some control. Again, from the results of US, UK and Israel, a reasonable guess can be made that, say, if around 30 to 35% of the population receives the first dose of the vaccine, the coronavirus pandemic over there seems like it gets under some control. If this assertion that the coronavirus pandemic is brought under some control once around 30 to 35% of the population receives the first dose of the vaccine is true, then we might witness this getting effect in countries like Germany, Canada, Italy, etc. quite soon as well, as the first dose of the vaccinations over there is approaching around 30 to 35%. And we can notice that cases over there as well seem to have started to decline as well. I have also said in my previous video that increased production from Covaxin and Covishield, as well as imports from the foreign-made vaccines, India is likely to vaccinate around 30 to 35% of its population in 2 to 3 months' time. With regards to this, the existing coronavirus vaccines that are available in the India market, which are Covaxin, Covishield, and Sputnik, have already said that they are planning to increase their manufacturing capabilities. Besides this, there are other vaccine candidates such as those from Biological E, Zydus Cadila, Genova, and Novavax, which are in the third stage of testing, and subject to approval, they will be available in the market in the coming months, which means that the rate of vaccination in our country is likely to improve in the coming months. The health minister has recently said that India is planning to provide 51.6 crore or 516 million vaccination doses by July. The government has also said that it has set up a target to vaccinate entire adult population of India by providing around 267 crores or 2.67 billion doses of coronavirus vaccine by the year end. The government estimates that production from all these vaccines put together will help them in achieving their target. Therefore, it can still be claimed that India is likely to bring the pandemic under some control, as what we have seen in US, UK and Israel, by vaccinating substantial chunk of its population coming 2 to 3 months. And hopefully by the end of this year, once most of the population in India gets vaccinated, the situation will get very close to normalizing.